Hello, my name is Jamie Kanukin, and I'm an IBD specialist at the University of Michigan, and welcome to the IBD 200 series. In this video, we will be talking about surveillance of dysplasia in inflammatory bowel disease. You should have previously watched our video on dysplasia in inflammatory bowel disease. This video will be discussing how we perform surveillance and detect dysplasia in patients with IBD. Surveillance for dysplasia in colorectal cancer in patients with IBD is done using high-definition colonoscopy. At this point, there are no other effective methods for detecting dysplasia in patients with IBD. Although sometimes your physician might use a technique called Chroma endoscopy to assess for dysplasia in the colon, this is still done using a colonoscopy. Chroma endoscopy is a specialized colonoscopy that is performed with blue dye that is applied throughout the colon. The blue dye is either methylene blue or indigo carmine, can enhance our ability to detect dysplasia in the colon. Currently, Chroma endoscopy is typically being done in patients that are at the highest risk for dysplasia, meaning those patients with PSC or a prior history of dysplasia in the colon. However, recent recommendations suggest that providers should consider performing Chroma endoscopy in more patients with Crohn's disease and ulcerative colitis who are at risk. Surveillance is important 8 years after disease because, as we discussed in the previous video, one of the risk factors for developing dysplasia is the length of time that you've had disease. Surveillance is also very useful for detecting dysplastic lesions, as they're often able to be removed at the time of colonoscopy, thus preventing further progression towards cancer. If a lesion or dysplasia cannot be removed at the time of colonoscopy, a referral to a more advanced endoscopy center or surgeon is necessary. The current guidelines in the United States recommend that surveillance is completed every 1 to 3 years based on the presence of risk factors for dysplasia. You should discuss your surveillance interval with your treating physician. It is important that you follow up with your physician to discuss your surveillance plan, as this is currently the only way that we have to prevent colon cancer in patients with inflammatory bowel disease. I'm Jamie Kanukin, and thank you for watching.